Thank you, Congressman Mass. I really appreciate you putting this together. I think this is really important, very important. Hopefully, obviously, will not be the first. I suspect there will be many. My name is Peter Knowlton. I'm the Vice President. I am a Vice President of the United Electrical Radio and Machine Workers of America, or as our union is known, the UE. I'm President of the Northeast region. UE represents manufacturing and municipal workers throughout Massachusetts and the United States, and was one of the founding unions of the CIO in the late 1930s. Most recently, you might know us when 250 of our members and their families of Local 1110 occupied Republic windows and doors in Chicago for 6 days to secure the 60 days pay and benefits, including health insurance, that was owed to them under the WARN Act. UE has supported the creation of a national public health insurance program since our founding in 1936. We are also a founding member of Labor for Single Payer. In the last 20 years, hourly workers, the majority of taxpayers in any state, have been getting fleeced by the private health insurance industry. And Massachusetts Chapter 58 did nothing to stop that. For 20 years, employers have been attempting, and in most cases succeeding, making us pay more for our health insurance industry's ever-increasing costs. It has caused strikes, lockouts, plant closings, and occupations. They literally tell us at the bargaining table, we cannot afford to give you a Cadillac insurance plan. If you want a Cadillac, you have to buy it. We reject, and we all should reject, the notion that receiving affordable, quality health insurance should be based on whether or not you can afford a Cadillac. Prior to the 1980s, workers had health insurance that was affordable, accessible, and we had our choice of providers. In the space of 20 years, what used to be standard has now become a luxury. It is especially provoking for us on our side of the table to hear from executives who make 6- or 7-figure incomes, paying a fraction of their income to health insurance compared to us that we can't afford a Cadillac. The private health insurance industry costs every year. It goes up. Massachusetts Chapter 58 has done nothing to even slow that down. Every contract, our members face huge pressures to increase the co-pays for every type of procedure, material and drug, deductibles, out-of-pocket expenses, and restrictions on providers, or take less in pay. Each and every year, a larger percentage of our income is spent on health insurance. Each and every year, the industry comes up with some wacky new scheme to maintain or increase profits at the expense of the subscriber, our members or ourselves, the employer, and now in Massachusetts, the taxpayer. The newest scheme is health savings accounts and high deductible plans, which only benefit high wage earners and people who don't need medications or to see a healthcare provider on a regular basis. It places the greatest financial burdens on low wage earners, people who need to see a healthcare provider on a regular basis, the elderly, and families. It is the ultimate expression of dog eat dog, where the policy pits old against young, sick against healthy, and families against boomers. Up until the 1980s, we all had fee for service, and it was 100% paid by our employers. In the 1980s, it was health maintenance organizations and preferred provider organizations. And if people remember, premiums went down, because the trade-off was we had a gatekeeper system. But the beginning of the 21st century is the worst of all. It's individual mandates for private health insurance, which force consumers and workers to buy lousy health insurance with high co-pays, high deductibles, and out-of-pocket expenses. The free marketeers and the health insurance industry are trying to force us into a private system, and every time you get health care, you pay a user tax. You pay a user fee, which they can increase against us at their leisure. And they do this each and every year. They don't need to take a vote. They just increase the costs. The private health insurance industry has become the 21st century version of the East India Company. Yes. Our funding of health insurance is the most severe regressive taxation. Under Chapter 58, if you and your spouse make over 300% of the federal poverty level, or $42,013, for a family of 2 and you're self-employed, you pay market rates for health insurance which means you could pay upwards of 34% of your family income to health insurance, and you're left with $27,729. But if you make $500,000 a year, you pay 4% of your income, and you're left with $480,000. Working people continue to get squeezed, and wealthy people have no enforceable accountability to pay their fair share. I can provide you with a clear but typical example of how private health insurance industry over the last 13 years has crippled our members' ability to earn a decent living, and where Chapter 58 has done nothing to relieve the pressure. In 1996, members of UE Local 204 at Hascon Corporation, a manufacturer of silicone and rubber aircraft seals in Taunton, Mass., paid a little for health insurance for themselves or family members and paid nothing for the premium. It was a low pay, no deductible, no additional out-of-pocket expense Harvard Pilgrim HMO on an average weekly wage of $464 for a finisher. Today, 13 years later, on a weekly wage of $584.80, $49 of that every week, or 8.4%, goes to Harvard Pilgrim. In addition, doctor's visits were $5, now they're $20 to $25. Emergency rooms were $25, now they're $75. There was no copay for inpatient or outpatient, now it's $100. RXs were $5 for generic, $10 for brand. Now it's $5 for generic, $20 for brand name, and $40 for non-formula. Workers with health problems pay upwards of 15 to 20% of their income for health insurance because of the copays. And the company is paying an outrageous 25% of payroll. A little caveat to this, it's sort of interesting based upon Chapter 58, because all employers think that they can now throw you out on the street and you'll be covered for health insurance. So for our members, when they would receive short-term disability, which we call sickness and accident insurance, or when you go out on workers' comp, the company used to pay the full boat of the health insurance. Now, because of the Massachusetts Chapter 58, when you go out on A&S or you go out on workers' comp, the employer is attempting to cut it off completely, figuring that Massachusetts will pick up the tab. It is why 43 local and regional elected leaders in Massachusetts sent a letter last week to President Obama, Senators Kennedy and Kerry, and the Massachusetts congressional representatives concerning Chapter 58, which read in part, "It has failed to control costs, and it has cost the state far more than initially projected. Many critical healthcare facilities that serve low-income communities are facing huge cuts, while healthcare premiums continue to rise by double digits each year. The Massachusetts plan is widely recognized as unsustainable." Another caveat, we could not have gotten 20 people to sign that letter for labor leaders in Massachusetts 5 years ago. Single-payer public health insurance has been endorsed now by nearly 500 union organizations in 49 states. Endorsers include 118 central labor councils and area labor federations and 39 state AFL-CIOs, including Massachusetts just last year. 20 international unions have endorsed it. The list continues to grow as the crisis deepens. We cannot afford mandates for private health insurance, payer play, or other corporate private schemes which do not solve the inherent contradiction of providing a basic human right as a commodity and which discriminates and places an unfair burden against the vast majority of us who live in this country. Thank you very much.